Welcome to our March 21st Kids Count Coffee. It's spring. I hear a lot of people talking about how we're seeing some bright thing in the sky that's been kind of unfamiliar for a while. It's kind of nice. No more ice on our driveways, which is also nice. So thank you for having me up in Brooklyn Center. Always nice to come back to Northwest Hennepin, where I worked for a while when my kids were really itty-bitty. So we'll get started with the Kids Count data book. Did everybody pick one up? Because this will be kind of your PowerPoint that you can follow along with the graphics as we go. This was working.
Excuse me, who are you?
Good question. My name is Jennifer Bertram, and this was working a second ago, and it's not now. So we're going to Jennifer Bertram. I work for Children's Defense Fund Minnesota as the Kids Count coordinator. And Children's Defense Fund is a national organization that was founded by Marian Wright Edelman in the 1970s, and she has recently actually stepped out of her role as president, which was pretty big news. After 45 years, she's currently serving on the board and in the office of the founder, President Emerita, and we're in a national search for a new leader at our national level, which is kind of a big deal. She decided she wanted to do some movement building and some organizing and writing and collecting of her memoirs as she kind of lives out her last days and wants to make sure that her grandchildren don't have to go through a lot of the same things that she did. So she didn't want to be bothered with the day-to-day operations of an organization. So yeah, we're in a bit of transition. But Children's Defense Fund is a nonprofit, nonpartisan organization, and we're lucky to be one of 8 state and regional offices of the Children's Defense Fund. Our mission to leave no child behind is to ensure every child a healthy start, head start, fair start, safe start, and a moral start in life, and successful passage to adulthood with the help of caring families and communities. So our local office, based in St. Paul, has a number of programs that we operate, including our legislative advocacy work, and I'll give you a little update on what we're following in the legislature toward the end of the presentation. But we do a lot of advocacy around early childhood, health care, child care, a lot of things that you all are very interested in as well. Our research centers around the Kids Count Data Book project that I operate. We have Stephanie Hoganson, who used to be in my role, has moved into an outreach role working on our Bridge to Benefits tool. And there are some flyers over there on the table that you can take. But it's a kind of an interactive tool where you can input some kind of basic demographic and financial information and determine eligibility for a number of programs, which is a nice, useful tool for, I think, a lot of food shelves and nonprofits use it with their clients to help determine potential eligibility for a number of services and programs. Our Voices and Choices Coalition is a group of individuals who advocate for the needs of children of color and American Indian children from prenatal to 8, predominantly around their health and well-being and educational outcomes. And then we have a number of freedom schools, including several in Osseo, with the Osseo School District, that operate as after-school programs and also intensive summer programs. And we attract young ones who have fallen behind academically, and it gives them sort of this boost with a curriculum to help develop their academic skills and help them achieve some success in schools. And then our Beat the Odds Scholarship is something we award to 5 individuals every spring. And so we have our Beat the Odds gala coming up, our little awards ceremony coming up April 18th. So I have some invitations over there if anybody's interested in joining us. It's a fun night where we get to really honor these 5 people who receive our scholarship. And they get, along with a scholarship, a laptop and some bundles of things that youth need as they go off to school, sheets and towels and things like that. So it's a really fun night. And I think we had 272 applicants this year, so I'm really glad I didn't have to decide which 5 were going to receive that scholarship. When we look at data for this project, we acknowledge and understand and try to look at a lot of this data from the lens of the fact that Minnesota has traditionally been and continues to be a white majority state, and that a lot of policies historically and practices have affected people of color, and that has a major impact on children's outcomes. So looking at data from a standpoint of disaggregating by race and ethnicity helps us better hone in on what are those challenges facing our children of color in our state. And then Kids Count Data Center is a great interactive tool that can be used by anyone who wants to look at some trends in data for a whole host of indicators that we update locally, but also the National Kids Count Data Project updates as well. So if you go to datacenter.kidscount.org, you can click on Minnesota, the state map, and find the list, and you can make graphs and charts and maps and things like that. So it's a great, very user-friendly interactive tool if you're looking for data. And every year when we put together our data book, we organize it around a theme. And something that kept coming up for us as I was determining how to approach the data for this first time around for me was community. That we talk a lot about communities, not necessarily from a standpoint of geography and city. I mean, we do that too, but also, you know, people form communities in schools or in neighborhoods or in, you know, ethnic groups or nationalities, and they use those communities, those informal support networks, to help raise children and help support each other. And so the initial essay and some of the work throughout the data book this year kind of centers around that idea that Minnesota is built on a lot of emphasis on local control and local customization of programs and services that meet the unique needs of their own communities, and that's a strength of our Minnesota cities and towns across the state. So celebrating that and honoring those unique ways of approaching the needs of our children and families is something to be commended. So a lot of the data that we do use is from the census, and we have a census coming up in 2020. I'll talk a little bit about that. But the major racial and ethnic categories that they use are those that I'll be using throughout the data book, because that's traditionally what we have available. It would be great to further disaggregate those categories to really hone in on what the needs are of our communities, but a lot of that isn't available. So right now, this is kind of the breakdown of our racial and ethnic groups. We have still 70% are non-Hispanic white, but our children of color are definitely growing, and I know that's definitely a fact here in the Northwest Hennepin area. Census 2020, the National Kids Count Data Book Project is very interested in paying very close attention to the lead up to Census 2020 because we rely so heavily on census data for our work, and we want to make sure that we have a full count so that the data that we use is actually accurate and represents the full picture of who is living in our country and in our state. And locally, it's really important to ensure a full count in Minnesota, because we were the last to keep our 8 congressional districts in 2010, and we are at the bottom of the list to maintain that 8th congressional seat this year as well, or this time around. So we got to count every single person in our state if we'd like to keep that 8th congressional seat. And interestingly, it's noted that children under age 5 are one of the highest undercounted groups. People forget to count their babies, or parents of young children don't fill out the forms as much as a lot of other people. So while Kids Count relies on good data to use, we also know that federal allocations of dollars for a lot of programs are based on census figures. And we do know that there are some undercounted census tracts in this area and in North Minneapolis and some of the other pockets in the Twin Cities area for sure. So I have been working on the Minnesota Census Mobilization Partnership, which is organized by the Minnesota Council on Foundations. Bob Tracy is currently the Director of Public Policy there. He's retiring in August. And I just found out this morning that they just named their new executive director for the Minnesota Council on Foundations, Susie Brown. So that's exciting. I like Susie. She was at the Minnesota Council on Nonprofits for a while as their public policy director. So the Census Mobilization Partnership is meeting quarterly right now to develop a plan for outreach for Minnesota to ensure a complete count. And I've been part of a co-creation partnership that includes people from a number of undercounted communities to help ensure that we have a good outreach plan that helps address people's fears or concerns about answering the census. You've probably heard about a citizenship question that was tried to sneak in at the last minute that's going to end up going to the Supreme Court to determine whether it's constitutional for that question to have been added. We hope that they will decide that it will be left off the forms, but we'll see. Because I think that could potentially make the people unwilling to respond to the census, which could have some dire consequences here in Minnesota. So a number of organizations have started local complete count committees to help spread the word and help people respond to the census. So yeah, it's a multi-year process to get this census underway and make sure that we have the best count we can for Minnesota. So the National Kids Count Project puts together its own data book, and it will be released this summer in June. So last June, their data book ranked all the states according to 16 indicators in 4 different subcategories, and Minnesota ranked 4th overall, which that was the same ranking we had the prior year. But I really noted that we went from 8th to 11th in education, and we dropped from 1st to 6th in health, and we also dropped in family and community and economic well-being as well. So while we retained that overall 4th ranking, we dropped in each of the subcategories, and that's concerning for us. And we also always try to remember and say that while overall children are doing pretty well in Minnesota, we have a lot of children who aren't doing so well, and that if you disaggregate our data, you really see that. So this year I organized a data book by those 4 components of child well-being that mirror the national categories, so we'll go into each of those. The first, safe and supportive homes and communities. We know that safety is of the critically important to children's overall well-being, so making sure they're safe in their families, safe in their neighborhoods and schools, that will help ensure a good start for their other needs. So notably, this is sort of one of the most telling ways to show some racial discrimination and segregation, that we have about 1% of our white children who live in areas of concentrated poverty, which is defined by you have at least 30% of children in that census tract who live in poverty, whose family of 4 has about $25,000 a year to live on. versus almost a quarter of our American Indian children and African American children. So, and even if your own family doesn't live in poverty, if you're living in an area of concentrated poverty, you're living in an area that lacks access to resources. And I know that's something that is talked about a lot in Northwest, to make sure we have resources and services available to the people who need them nearby. But I think research shows that children's outcomes are poor if they do live in an area that lacks access to resources, in an area that is in poverty. And another note related to safety, children in out-of-home placements for foster care, we see huge disparities there for American Indian children, but also African American children. And that is something that has been talked about a lot at the legislature and at the state level, to determine how they can address those vast disparities in out-of-home placements and in involvement with the child protection system. So the Legislative Task Force on Child Protection is continuing to work to monitor that, and there have been some discussions at the legislature this year on how to try to address some of those disparities in out-of-home placement. So for each of our 4 child well-being categories, we have some policy recommendations. So one is to continue to examine those recommendations that the Governor's Task Force on Child Protection issued in 2015. They put together 93 recommendations that the Legislative Task Force has now been looking into and working with the Department of Human Services to determine how to approach those recommendations and make some policy changes and improve funding to be able to address some of those challenges in the child protection system. The Family First Prevention Services Act was passed in Congress last year, and that's actually a pretty big shift in the way that funding can be used from the federal government for child protection work. So Title IV dollars traditionally have only been able to be used if you put a child in out-of-home placement, but this would shift that so that that money can be accessed for families who continue to have their children in home if their parent needs substance abuse treatment or needs some level of services. So Minnesota is working on determining how they will implement that, and we have another year or two, depending on whether we get a variance, to be able to get an extension on how to implement that plan. In Minnesota, we're a state supervised county administered system, so it's a little tricky because we have 87 different counties that do things almost 87 different ways. There are a few counties that have merged their social services, but it's a little complicated in Minnesota. But we're looking at that and hoping that we can help preserve people in their families while giving them needed services. So we think this is a step in the right direction. The Governor's Task Force on Housing last summer issued 6 broad goals on increasing affordability and availability of stable housing options. And I was just listening to NPR on the way up here and heard the Wilder Foundation had their homeless study in the fall, and they're just releasing some of their preliminary findings, and homelessness is up compared to 3 years ago. And there's a lot more people living on the streets. So those were the little snippets that I heard this morning. So this is definitely something that is of big interest and need in our state. Affordability of housing is a big problem. So, and then also targeting some investments in those areas of high poverty to help people get access to transportation, employment, and other things to stabilize families. Schools are a great way to serve as a community hub. I know when my children started school, that was a place where we started to meet more friends and more neighbors because we got to know the people in their classes, and it serves as a place for people to gather and form those informal and formal supports. And a lot of schools are developing additional services and supports right there in the school, which I think is great. So it's a nice community hub. Our emphasis on early childhood, one of the kind of starkest pieces of data that we came across this year is this huge shortage. It's not a real secret, but there's such a huge shortage of childcare availability in this state, particularly infant care. But every region in the state is experiencing a major shortfall in available options for families, and that's not even going into affordability. So that's a major challenge that a lot of people are trying to address, and businesses are also starting to come to the table more so because they see that it's a business problem too if they can't recruit people because they don't have childcare. So
Jennifer?
yeah.
Back to that other slide, this last slide that you had.
Uh-huh.
The western side of the state appeared to be doing a little better with regards to that desert piece.
Yeah.
Any conclusions or theories about why the western? I mean, everything, like you said, has that is a desert.
Mm-hmm.
It seems to be a little. The pie looks a little fuller on the left-hand western side of the state.
That's true, yeah. And I have been to both of those areas. I don't know that I can pinpoint exactly what they're doing there that's more useful. I know that the Minnesota Initiative Foundations all have an early childhood component and have done a lot of development and resource allocation to try and shore up some of those shortfalls in childcare. So yeah, we'll have to see what, maybe I'll have to look into that and see what is it that you're doing that's helpful. But yeah, 45,000 slots just in the Twin Cities alone is the shortfall according to that chart. So it's a big deal. This just illustrates the variety of programs and services available to children before they enter kindergarten. So in 2017, we had about 67,000 kindergartners, and of those, about 13% had accessed the Child Care Assistance Program, which is financial support for families to access child care. 10% early childhood family education, which I'm a huge fan of. And early childhood special education, about 13%. We know that when children access services early on, if they have an identified disability of some sort, then that helps propel them to better success when they start kindergarten. So reaching those children early is really beneficial for children and families, and having access to those services through schools is really helpful, right, too. District preschool, one of those new programs, almost a quarter of children were able to access that. So that's a nice resource available both for high quality early childhood education, but also childcare for families as well. The Office for the Legislative Auditor released a report last year looking at, taking a closer look at about 7 programs in our state that serve the young children, and identified that we have about 43 separate types of programs and services that serve early childhood, and all of them have different ways of approaching the work and different funding streams, and it's complicated, right? So they recommended that we streamline some of that and maybe narrow down the options and make it a little easier for families to access. And I know there is a proposal in the legislature right now that would have programs use a unique identifier number, just like K-12 uses for children, so that when a child accesses maybe home visiting and ECFE and ECSE and district preschool, they can follow that child through and see, you know, what was it that really supported that child's needs to be able to be ready for kindergarten. So that's a little controversial. There are people who don't support the idea of one of those unique identifying numbers. So we'll see how that plays out. And I don't know, you might have heard in the news some controversy over some discussion about fraud in the Child Care Assistance Program. So the Office of Legislative Auditor just released their analysis of the allegations of the CCAP program on Wednesday of last week. So we were paying close attention to that because we are big advocates at CDF of the CCAP program. And essentially, a while back, there was a man who used to work for the Department of Human Services who made some allegations that there's a lot of fraud in this CCAP program and that up to $100 million a year was being defrauded, used fraudulently, and being taken to Somalia to fund terrorism. Yes, that's what he said. And Fox 9 News covered it, and it became a huge controversy last fall. So the Office for the Legislative Auditor was asked to determine whether those allegations were true, and they came out with their report and essentially decided no, a lot of that was not true. There is fraud in the CCAP program, but they could only attribute that to about 5 or 6 million over the last few years, and some people have been charged and convicted with that fraudulent activity. Some of the ways that that happens is people open up sort of a shell of a center, of a child care center, and then they fraudulently pretend like they have staff, and then those staff pretend like they enroll children, and then they take that money for CCAP. Those people enroll their children in CCAP, and then they use that fraudulently. So it was sort of a sensationalistic journalist approach to the allegations that exaggerated widely how the money was being used and how much of it was being used and how it was being sent overseas. But kind of thankfully, because we were hopeful that the CCAP program uses only about $250 million a year they distribute for child care slots. So $100 million would be a pretty significant proportion of the dollars being allocated that would be going towards fraud. So it's a lot less than that, up to $5 million over the last few years, like I said. But they also kind of left the door open, saying they know that there's probably more fraud, but they couldn't pinpoint it, and that it's really hard to nail that down. So that's a tough thing to have to counteract if you're trying to advocate for additional dollars for people who are working hard and want to be able to put their child in a high-quality early learning facility, to have to counteract that argument. So that's been some interesting stuff at the legislature this year. But we are hopeful that we can kind of move forward, and there are some steps being taken at DHS to help address maybe some internal controls and ways that they can better track how funds are being used and address some of those challenges so that we can go back to advocating for people to be receiving those helpful dollars for their child care needs. So recommendations that we have for early childhood and K-12 education include a mixed delivery early childhood system. We know that one size doesn't fit all, and we need to be able to offer a variety of services and supports to families in those early years, making sure that programs are culturally appropriate and relevant for the diverse children and families that they serve. We propose, through our Voices and Choices Coalition, a community solutions fund for healthy child development. This would put dollars in the hands of communities that know their needs best and are able to shape programs that meet those unique needs. And that's seeing some traction in the legislature this year. Our current Lieutenant Governor Peggy Flanagan is our former executive director at Children's Defense Fund Minnesota, and she helped establish the Voices and Choices Coalition and helped to help develop the idea for this Community Solutions Fund. And so she and Governor Walz have included that as a line item in their budget, which we're pleased about, and it has made it through the hearing, the initial deadline for the hearing process. So we see that as a policy win so far in the legislative session. Considering those OLA recommendations for early childhood programs, increasing attendance. We know when children show up to school, they do better. So making sure that that children are supported and they get some help with ensuring that they make it to school. There's some movement at the legislature for some support around attracting and retaining teachers of color. As our schools become more diverse, we'd like to see our workforce in the schools become additionally more diverse to represent those that they serve, and increasing funding for after-school and summer programs, which are a helpful resource for families who need that for childcare, but also able to support educational needs for children. Economic well-being, we know that a lot of families are living paycheck to paycheck, and that even an extra $1,000 a year would go a long way towards helping families meet those basic needs. So here you'll see some pretty wide disparities again with the percentage of children living in poverty by race and ethnicity. So about 7% of white children, and then you see 36% of American Indian and 38% of African American. So, but overall, still 13% of children in Minnesota, so more than 1 in 10, are living in poverty. And again, that's about $25,000 for a family of 4. So it's, as Mrs. Edelman would say, that's just shameful in a country that has the kind of resources that we have. There have been some great strides being made. We increased our minimum wage at the state level, and Minneapolis and St. Paul now are both going towards stepping over the next few years towards a $15 minimum wage. But interestingly, the Department of Employment and Economic Development estimates that a statewide living wage for 2 earners with 2 children would equate to about $21-23 an hour, or just over $88,000 a year. So even that $15 minimum wage doesn't quite meet that estimate of a living wage where people are able to pay for all of their basic needs. So at CDF, we advocate for really making sure that work support programs like SNAP and medical assistance help fill in those gaps between those lower wages and the basic needs that families have. So policy recommendations for economic well-being include increasing the Minnesota Family Investment Program cash grant, and I'll tell you a little bit about some updates for that in a second. But that cash grant for our state welfare program hasn't been increased since 1986. We tried really hard in the last legislative session and for the last few legislative sessions to get even a slight increase and didn't make it. So this year there is some movement that we're hoping we can get an increase. The best option would be to look back at 1986 dollars and match it to 2019 dollars to make those dollars equate. But that's probably not going to happen. But if we even increase it a couple $100s, that will go a long way towards supporting the families who receive that fund. And then we're also advocating for a statewide paid family and medical leave insurance program. We are co-leaders of the coalition that is supporting that. And we have had some hearings about the paid family and medical leave insurance program, so I'll tell you about that. Expanding the working family credit. Families really do benefit from getting a little money back on their taxes to be able to address some of their budget needs. So moving on to health coverage and care. We know when children have access to their preventive care, our whole community benefits. When children aren't as sick in schools and they get what they need, then the whole school is less sick, and our whole community has lower rates of uncompensated care in our hospitals and clinics, and more productive citizens. So the Affordable Care Act or Obamacare of 2013 really went a long way towards lowering the rates of uninsured in Minnesota, and we are one of the states that expanded Medicaid under that law. So you'll see here that we had a sharp increase over those years from 2013 to 2017 in our medical assistance program, and then a decrease in Minnesota Care because more people became eligible for medical assistance. So over the last several years, we've seen a drop, especially among Latino and American Indian children who lacked access to care, to health insurance, but they still hover a little above 10%. And we're seeing an uptick in uninsured rates, particularly for our Latino children. And I was just at a meeting at the Department of Health the other day, and I think sneak peek to 2017, we're going to see an additional uptick of uninsured children, particularly in our Latino communities. So that's a challenge that we need to work on, particularly for those populations. So our recommendations in policy include addressing the disparities in access to coverage and health outcomes, targeting outreach. We know that outreach does help when people have assistance in determining their eligibility for certain health programs and assistance in filling out those complicated forms and understanding what they need. That does go a long way towards ensuring that people do access those programs that they're eligible for. Increasing funding for family home visiting programs. I know Representative Pinto is a proponent of that, and he's a big champion at the legislature on early childhood overall. So he's the chair of the Early Childhood Policy Committee and has really been talking a lot this legislative session about how to increase funding for prenatal care, family home visiting, early childhood education. So we'll see how that goes. Identifying barriers to dental care access. We've been hearing over and over again that children on medical assistance have a really hard time finding a dentist who will take their insurance. And I think I put a graphic in the data book this year that in 2017, 36.5% of children who had medical assistance were able to see a dentist that year. And I will say that those 36%, they probably had someone, a parent or someone who worked really hard to find a dentist, and maybe in greater Minnesota drove 3 hours because that was the closest they could find. So improving those, that access to dental care is of critical importance right now. And I know that there's some movement in the legislature to help increase the reimbursement rates, because the reimbursement rates for medical assistance to dentists is quite low. But also there are some other barriers, and we need to address some of that as well. So, and another thing that we've been working on is the provider tax that's been in place for a number of years that helps fund the Healthcare Access Fund is set to sunset at the end of 2019, and that Access Fund has helped fund a lot of our healthcare programs in Minnesota. So we want to extend that, and I'll tell you in a second, but there's actually an event this morning about that. So here's a little more in-depth update from our policy director, that the Paid Family and Medical Leave Act would provide up to 12 weeks of partial wage replacement for family and medical leave, including pregnancy and maternity leave. So Minnesotans can take care of themselves. It would replace wages on a progressive scale depending on your income from about 55 to 90% of your employee's salary, while protecting your job and your health care benefits. So it creates a large statewide pool that would be funded through a small tax, a payroll tax that would that both employers and employees would contribute to. So for a median worker, this would be less than $2 a week for Minnesota. This Our policy director has spent a lot of time on this one because it's already been through 4 committees and then it's going through 3 more committees before it reaches its final destination in taxes this year. So spent a lot of time at the Capitol and working through all the steps that this one needed to take, but we're seeing some major progress, and in the House at least we will see it through all the way to the taxes committee. The healthcare provider tax, it funds services for more than 1 million Minnesotans, including medical assistance, the state contribution towards that. So allowing this provider tax to expire would create a shortfall of revenue of about $680 million. So trying to use general funds to help shore up that would really cut into other budgets. So we really believe that this sunset needs to be repealed. So there's actually a rally at the Rotunda this morning to really bring people together to promote the need for this to be repealed and to make sure that that provider tax stays in place. So it is included in the governor's budget, so we'll see what happens at the legislature. And like I said, the MFIP cash grant hasn't increased since 1986. Right now, $532 for a family of 3, and we know very well that doesn't go very far in 2019 dollars. And a lot of the people who access MFIP are children under age 5. So we really need to see an increase in that. Right now, there's 3 separate bills that are being heard in the legislature. So, oh, I thought I updated that, sorry. So one would be a $100 increase across the board. Another would be a $200 increase that would stagger over the next 4 years. That includes a cost of living adjustment, so it would additionally increase and update after that. And then there's a catch-up grant to inflation, which I said, that's what advocates would really like, but probably not so realistic. But we'll see. I hope that we can at least get somewhere in the legislature this year and get that signed into law. Working family credit, there's a proposal to change the structure of it to add a 3rd tier for families who have 3 or more children. And that's seeing a little bit of movement in the legislature, and it is in the governor's budget. So we'll see if we can get that going through. And then, as I mentioned, the Community Solutions Grant Program did squeak by and make it past that first deadline in the House. So the governor's budget included a $2 million one-time money allocation for this program. Our bill was asking for $7 million and then $5 million moving forward. But these grants would be designated to cultural communities across the state to work on approaches to improving child well-being for children of color and American Indian children from prenatal to 3rd grade. We co-chair the Kids Can't Wait Coalition, which advocates for the Child Care Assistance Program funding. And ideally, and this is something that Walls and Flanagan talked about on the campaign trail, that we'd like to have a fully funded and forecasted CCAP program so that people don't have to be on waiting lists to be able to get access to that program and services. And then a second piece of it is the last year at the legislative session, we were able to pass federal conformity for access to the dollars that are allocated through the Child Care Development Block Grant. Right now, Minnesota is not in compliance for the federal requirements to be able to draw down those dollars to fund our CCAP program. And it passed in the legislature, and if you remember back to last year, Governor Dayton got that huge super omnibus bill and vetoed it all. And so the conformity measures that weren't even, didn't even have a dollar figure, didn't have a fiscal note attached to it, but that didn't pass either because it was wrapped into the super omnibus bill. So we're having to start over and get that passed again, and there's been some resistance in the Senate. So we're hoping that we can get at least that conformity piece done so that we don't have penalties with our CCDBG block grant, and so that we can access those dollars fully so that we can use them towards our child care assistance program. But also, one of the challenges is that the CCAP funding allocations are based on an old survey of current market rate for childcare, so it's based on the 2011 survey and not the most recent. So when CCAP gives providers funds for childcare slots, they don't match the market rate 100%. It's based on a percentage, and we'd like to advocate for the reimbursement rate to be 100% of market rate, but we know we can't quite get there. So what we'd like to see is 100% for infant care, because it is so hard for anybody to get infant care, and much harder if you're receiving CCAP and the market rate reimbursement is so low. So we're hoping for 100% for infant care and 75% for toddlers and preschoolers. We'll see. That's about where we're at right now. So the governor's budget wants to fund 1,000 additional families for CCAP, so they have money in their budget for that. And then increasing those reimbursement rates and updating to the current market survey. And then putting language in the statutes that would ensure that they always are using the most recent market rate survey, so that we don't have to keep going back and saying, now let's go to this current one. So we'll see how that goes. Again, Representative Pinto has been a big champion for all of these measures in his early childhood committee, and we'll see if we can make it happen in the Senate.
Is the slide that said, at the end of that slide, it said something about his hearing also looking at expanding the scholarship piece. Is that around the early childhood scholarships?
Yes.
Okay.
Yes, that is another approach, is giving children scholarships to attend a child care program of their choice. And there's been some discussion back and forth about how much to tie CCAP and the scholarships to Parent Aware star ratings, and I'm sure you guys have had discussions about that as well. So that's our legislative update. To take action, I know a lot of you are very active in the legislature and know your legislators and have had discussions. If you haven't already, I welcome you to join our email list to get updates on what we're up to at cdf-mn.org. We're pretty active on Facebook and Twitter. And then our coalitions, the Kids Can't Wait Coalition that advocates for CCAP, Minnesotans for Paid Family and Medical Leave, and then Voices and Choices. And then always encourage people to contact your legislators, contact your governors, write a letter to the editor of your local papers to advocate for things that are important to children and families in our state. So one of the ways that I included community was some community spotlights that you might have noticed throughout the data book. And Patina Park is the executive director of the Minnesota Indian Women's Resource Center. She was very busy when the encampment was very active in their area near Little Earth in Minneapolis. But she wrote this poem for me to include in the data book, and I just want to read it quickly to you because I think it really sums up how community can come together and support each other in a way that's very similar to family. So what does community mean to me? My community is my family. No matter how messy, no matter how complicated, no matter how dysfunctional or challenging, my community is my family. Family looks out for each other. Family loves each other even when we are unhappy with something they've done. family supports each other, family celebrates with each other, family cares for each other. And at its very core, community loves, honors, and respects the full humanity of each community member because we are family. And if any of you have had the opportunity to talk with Patina, she's an amazing woman and has done great work. And I think the beauty of that of that little essay really touched my heart. So I wanted to share that with you all. And then I am happy to answer any questions you might have.